Everyone, and welcome to the Culpeper Chamber of Commerce Town Hall on mental health, sponsored by Fakir Health. I'm Jeff Say, the president and CEO of the Culpeper Chamber of Commerce. Joining me is our events coordinator, Amy Frazier, and today we have several mental health professionals to chat with us about how to deal with the COVID-19 crisis and what they are seeing out in the world. Joining us today, we have Alan Rasmussen from RRCS. He's a prevention specialist for Rappahannock Rapidan Community Services. We have Craig Wilt, who's a bereavement coordinator for Hospice of the Piedmont. And we have Sally Morgan, who's the executive director of the Mental Health Association of Falk here. Everybody, thank you for joining us. And we'll start with Alan, and we'll have Alan present, and then we'll go to Craig, and then Sally will be able to present as well. So Alan, if you'd like to start us off, welcome and thank you for joining us here today.
Well, thank you for hosting this event. I'm glad to be here. As Jeff said, my name is Alan Rasmussen. I am a prevention specialist with Rappahannock Rapidan Community Services. I've worked in that capacity since 2003. And the focus of my work in that position has been on suicide prevention, mental health, and substance abuse prevention. Another focus of my work is to work closely with community partner groups and those that have lost loved ones to suicide or substance abuse to develop and create community and support community coalitions. In the prevention work, it's one team, one fight. So when you have coalitions, they are invaluable in helping us make a difference. I would like to take a second just to mention some of these coalitions because they really do make a huge difference in the work of prevention. And they were talking about Healthy Culpeper Community Partners, Partnerships for Community Resources in Fauquier, the Fauquier Mental Health Association, their mental health coalition. We have Living the Dream Foundation, Come As You Are, Team Jordan, and the Rusty Bowers Suicide Prevention Coalition. There's also Madison Strong Community Coalition in Madison County. One other point I would like to make before I get started, and this is a great way to town hall to be able to get the word out. I facilitate a Survivors for Life support group for those that have lost a loved one to suicide that Team Jordan sponsors. And this group, until the pandemic, met every third Monday of each month at 7 o'clock in the evening at RRCS main office. Right now we're meeting on Zoom if anybody is interested and needs that kind of support. It's for those that have lost a loved one to suicide. Check the rrcsb.org website to get the link to the Zoom meeting or contact me. So just as an introduction too, I want people to know I am mental health first aid certified as a trainer. I am a suicide prevention gatekeeper trainer, trained over 40,000 adults and youth to be gatekeepers related to recognizing people in distress. I'm an adverse childhood experience master trainer. And we know that these are unprecedented times. This coronavirus pandemic is an extreme adversity that can take a mental, emotional, and physical toll on individuals of all ages. We all feel vulnerable, especially individuals suffering from mental health disorders or those who have experienced trauma in the past. We need to be alert to any impact that this pandemic may be having on any of us and be alert to what I call warning signs, such as changes in mood and behavior. In the trainings I do, there's a whole list of warning signs of people who could be in distress. And if you take one of my gatekeeper trainings, you can learn those. But the big ones are looking for changes in mood. If people are getting angry, they're getting depressed, getting sad, and changes in behavior, sleep, eating, that kind of thing. And so, I always like to tell people, keep in mind that warning signs are what we see, and symptoms, what people are experiencing, is we don't see that. The only way we're going to know that is if we approach somebody when we see signs and talk to them and explore the signs that we see. So I would encourage people to definitely not be afraid to approach someone you're concerned about and ask questions like, what are you feeling? What are you experiencing? Let them know maybe, hey, I care about you and I want to help. And, so, being supportive in this way can make people feel connected, feel like there's hope if they're having problems. And I would also like to say, if your instincts say that something seriously is going on with this individual, and even if not, I'm going to ask the question. I do suicide prevention gatekeeper training. And one of the things you do when you see someone in distress is you ask, hey, are you having thoughts of suicide? And I think during these times, we have people that are resilient, they're bouncing back, and we have some people that are having some losses, some situational issues, and we need to keep an eye on them, and it can be devastating. So, and if somebody is thinking about suicide, they will likely tell you, and if they're not, they'll tell you that too. In either case, persuade them that there is help, there's hope, and if you need appropriate resources, you can contact RRCS. You can contact some of these coalition groups that I mentioned. All of us want to help the community members that are in distress. So there is help, there is hope. And, I always like to say, in cases of emergency, be sure to call 911. All of our law enforcement individuals are trained, they're alert, they know how to help, and definitely help people in an emergency. Now, one other thing during this town hall I would like to say is that, we need to keep in mind that times of crisis, such as this pandemic, can also bring out the best in people. And we have a history in this country of coming together to handle challenges and major issues. And we have a history of being resilient. Now, I do a lot of trainings, life skills training on building resilience. And so I wanted to take just a few moments to talk about some healthy habits, some steps that we can take that will help us improve our problem solving abilities in times like this, as well as our ability to manage our emotions and be resilient during this time of crisis and uncertainty. So just some tips to help. I would encourage people to consider maintaining your routines, healthy habits that work, make you feel comfortable, bring you peace, bring you certainty, keep good sleep hours. And, I don't want to sound like a parent, but, I do hear people talking about how sometimes they're staying up till 1 or 2 in the morning and then sleeping later. If you can keep good sleep hours, maintain those routines, it can help keep your good energy going. You want to try to maintain a healthy diet, regular eating hours. I heard someone say the other day, because they got out and were able to do some things that they hadn't been able to do for a while, and it wasn't going way out in the community, but just doing some routines, they felt normalized again. So it's you can exercise, hike, walk, do other exercises. I always think about constructive and enjoyable hobbies. It's a great time to do some things you've been wanting to do and keep some good energy to feel good about yourself and enjoy some leisure time activities. I always encourage this mindfulness, meditation, and yoga. If you've never done that, that can bring some peace and help you out. I would stay hydrated, make sure you're drinking fluids. I would avoid news stories if they increase your fear and anxiety. Now, I used to do parole work for about 28 years, so a lot of these news stories, they don't affect me like they may affect other people, but I have seen people get anxious, tense, agitated, fearful, and so if that's going on when you're watching the news, turn it off and watch something else. So I would encourage maintaining or developing healthy and supportive relationships. I always like to say, who's on your team? Is it your family, your friends, your church family, mentors, counselors, pets? Like Amy there. And so you can also, to avoid feelings of isolation and loneliness that can come with the social distancing. I always mention you can maintain contact with others through Zoom, FaceTime, telephone, emails, Google Meet. Stay in touch, talk to people. Another point, and if you're getting worn out, I'm almost done, but keep in mind, it's important to be focused and purposeful in what you do. So make a plan, make a list of what you'll do day to day, moment to moment to help you do that. And remember that you're not alone in this crisis, and many others are affected as well. And I always encourage people to find the positive in all situations, try to develop that deep optimism. We're going to get through this, we're going to make it. And it's like I say, one team, one fight. Please do try to avoid negative coping skills, like drinking, using drugs, or other negative coping skills. So with that said, I just want to remind people, if you need help, you need counseling, or you feel you need crisis services, call 540-825-5656. That's RRCS. And in cases of emergency, call 911. And best to everyone. Thank you for the time. I appreciate your patience.
Thank you, Alan. We greatly appreciate it, and great advice as always. You're watching the Culpeper Chamber of Commerce Town Hall on mental health, sponsored by Fauquier Health. And now we'll go over to Craig Wilt from Hospice of the Piedmont, and Craig will talk to us about some coping mechanisms as well. Craig, thank you for joining us. Oh, I think you have to unmute yourself. Thank you, Craig.
Thank you. Thank you for giving me this opportunity. As you had mentioned, my name is Craig Wilt, and I'm one of the bereavement counselors for Hospice of the Piedmont. And I'm going to start with our two telephone numbers. The local number is 540-825-4840, and we have a toll-free number, which is 1-800-975-5501. And the reason why I wanted to begin with those numbers is to make sure that everyone is aware that if you or you have a family member or friend who could benefit from some grief support, please feel invited and encouraged to share this information, because all of our grief care services are available to everyone. And there's never a charge. Right now, because of the unprecedented times, as Alan referred to them, primarily our support is being offered by phone, and we do have some online support groups that are coming up next week. So those are available. And in times when we're not dealing with the pandemic, we also offer both in-person visits at our office, and on occasion even in someone's home, particularly for someone who doesn't have transportation, or perhaps has their some other need that doesn't allow them to come to our office. Alan had mentioned about the pandemic just affecting us emotionally, physically, also spiritually, mentally, and grieving does as well. Even under the best of circumstances, grieving is truly a difficult process to have to deal with. And again, with this pandemic, so many things that people may rely on, especially when they're grieving the death of a loved one, well, those opportunities aren't available. One only has to take a look at the obituaries in the newspaper, and almost all of them conclude with something to the effect that due to the pandemic, the memorial service is being postponed or it's going to be private. And in my conversations with many bereaved folks, one of the things that's kind of surprising is many of them feel a sense of gratitude that their loved one maybe died prior to the pandemic. So at least they had the opportunity to be with that person and to say goodbye, and also to gather with family and friends for a family night or memorial service. But for those who did not, this is just an added stressor to already a very difficult situation. So many people do not have this opportunity at this time to spend the last moments with a loved one, particularly if they're in a hospital or healthcare facility that has a lot of visitor restrictions. I talked with a gentleman about a week ago whose only support happened to be his 3 sons who all lived out of the area. And they all were able to make it in for the memorial service and had to leave immediately because they were concerned that if they didn't go home, they wouldn't be able to take the airplane flights if they waited like another day. And so, the level of support that people may be accustomed to having or were relying on, well, that's not always there. But what I would like to emphasize is while grief is really powerful, our capacity to heal is even more powerful. And I would just encourage anyone who might benefit to contact me, to contact Hospice of the Piedmont, to have any conversations that you'd like about any needs, questions, or concerns you may have. And please know that reaching out for support is not a sign of weakness, but it takes a lot of courage and it takes a lot of strength to pick up that phone and to talk about the death of your loved one and a lot of the adjustments that you've been coping with. There is, as Alan said, different ways for us to cope, and some are healthy and some are not. There is kind of a cliche that says there's no right or wrong way to grieve. I disagree with that. I think that, as Alan had said, people who try to numb or suppress pain, whether it's through alcohol or narcotics or suppression of any other sort, the best way to approach it truly is to be able to share your thoughts, your feelings, your insights, share it with a trusted family member or friend, or if you'd like to talk to someone who you feel might be a little more objective, contact me, contact a grief counselor, someone. Just have that conversation, because I do believe that in that conversation, I'm not going to provide you with the pathway to follow. You will find it out for yourselves. Each individual will discover what works for them and what doesn't. And be assured that whatever it is you decide to do, there will always be someone who isn't going to like it. So try to tune out those outside messages, that are trying to micromanage your grief. And I would encourage everyone, be patient with yourself, be patient with your need to grieve. It is a lifelong process for many individuals. And that's not to sound discouraging. Honestly, the only way people, quote unquote, get over a death or find closure is to kind of live your life as if that person had never been a part of it. And I think for most of us, that approach is not acceptable. So again, please, if you or someone might benefit through some grief counseling, again, keep in mind that our services are available to everyone in the community, whether it's Culpeper or California. Know that we can be reached at 540-825-4840 and toll free at 1-800-975-5501. And like the CSB and a lot of other resources, there's a phrase about no wrong door. We have a tremendous resource list available as well. And, if there is an issue that I don't feel competent in addressing, I will help you identify someone who can. And so, Jeff, thank you so much. I really appreciate having this opportunity to share a little bit about what we have to offer. And I'm hoping that people will reach out and take advantage of the many resources that we are so blessed to have in the Culpeper area.
Craig, thank you very much. And your phone numbers have been shared in the chat. Amy has typed those in for everybody. So if you have questions, you can reach out to them at those phone numbers. thank you once again for joining us today, and thank you for your words. It was great advice. And now we'll go over to Sally Morgan, with the Executive Director of the Mental Health Association of Fauquier. And Sally.
Hello, everyone.
Thank you, Sally, for joining us.
I'm sorry I wasn't able to connect by video, but I hope you all can hear me.
Yes, we can. Thank you so much.
Okay, great. So let me just say that the Mental Health Association is a nonprofit. We call ourselves an advocacy and action group, and we're based primarily in Warrenton, serve primarily Fauquier and Rappahannock counties, but we offer a lot of educational programs and resources for the larger region as well. Our mission is to decrease the misinformation, fear, and stigma, which is unfortunately often associated with mental health issues and substance use issues. And we do that largely through education. Alan mentioned mental health first aid. We are approaching 2,000 people who've been trained in a full 8-hour mental health first aid course in this area, and that knowledge of how to look for problems and how to get people help is a tremendous resource for lay people throughout the area. The other main mission is to increase access to care. We have a large database of mental health providers and substance use providers. We offer information referral to help people find care when they need it, care that's affordable and appropriate for them. And we also have been working with partners to just increase the supply of mental health providers and the breadth of mental health services in this region. So even before the pandemic, we knew that we're living in an age when people are experiencing greater levels of anxiety and depression. And anxiety and depression often go together, and they sometimes, when they are intense enough, may lead individuals to feel like suicide is the only way out. We're seeing increased levels of rate of suicide. I think it's increased like 30% since the year 2000. And one of the things that concerns me is that we're seeing a lot of those symptoms in young people. We just conducted the Pride survey of 6,000 students in Fauquier and Rappahannock. 42% of middle and high school students have experienced symptoms of moderate to severe anxiety in the past year. 35% told us they'd had symptoms of clinical depression over the past year, and 27% had at some time thought, "I wish I were dead." They about 6% of them say they've thought about suicide often or frequently. So if you add to that level of fear and anxiety and stress, add the fear, disruption, and uncertainty that goes with this pandemic situation, and you've got a real recipe for significant increase in anxiety, depression, and substance use. The things that all of us, every single person in this country, in this world, are experiencing right now, one of them is uncertainty. How do we stay safe? When will this end? When will it be safe to go back to work? The other thing we're experiencing is reduced autonomy, reduced sense of control. We have fewer choices in some cases, and that sense of control over many parts of our life that we're used to feeling just isn't there. The other thing that we're experiencing is disruptions to our social connections. And it's the result of all of those things that affects our brain, it affects our bodies. People are concerned certainly about health themselves and their loved ones. They're experiencing isolation, which can result in loneliness, and sometimes the isolation, the social distancing, stay-at-home regimes right now can actually create too much togetherness in some cases. Situations where there are too many people in an enclosed space, or situations where there are difficult relationships. So we've heard from LGBTQ folks that many of them are feeling stressed by having to be at home. They're not able to connect with their normal social networks, and in situations where maybe there's some difficult relationships. So the stay-at-home can work both ways. Certainly people are worried about economic issues. They're unable to access some of the coping strategies they normally use. So for instance, if one of your coping strategies is to work out at the gym, do group exercise, well, that's something that hasn't been available to you, so you need to find something else. Being out with friends is a coping strategy a lot of people use, and again, having to find different ways to do that. As both, I think, Greg and Alan mentioned, I think one of the very sad things is that people have been unable to gather for the normal important occasions, not only funerals, but graduations, weddings, etc. And all of those things actually, it's interesting to listen to Craig talk about grief, but many of the reactions that people are having to the realities of the pandemic are very similar to grief reactions, that sense of loss, frustration, anger, etc. And there's certainly some populations that are particularly vulnerable. One of the groups we've heard from are caregivers who are taking care of an older person or a disabled individual, and that's always a stressful situation, but in this time they're not able to get help, they're not able to get out, and a lot of additional pressure there. Certainly those who live alone may be at greater risk of that loneliness that comes with isolation. And as Alan mentioned, those with a past history of trauma, anxiety, or depression are certainly at risk. Mental Health America does have a screening tool for both anxiety and depression. They have experienced like 150% increase in 1 month in people taking those anxiety screenings. And one of the things I thought was interesting was 74% of those are under age 25. And not only are more people getting screened, but their symptoms are more intense. So what they said is 9 out of 10 young people who are getting those screenings had moderate to severe anxiety. Excuse me. We also have seen increase in purchase of alcohol. Both Craig and Alan mentioned the danger of going to negative coping strategies. 55% increase probably translates into a 55% increase in consumption, and that can really have some negative impact. I was looking here at things you can do, and Alan did a great job of introducing many of those. I guess one thing I would say is we're all looking for ways to stay connected to each other. There is evidence that being able to see each other is actually preferable to just hearing ourselves on the phone, if that's possible. So the FaceTime and Zoom and those things do have some added value. 2 other things I would add to Alan's list. One is finding ways to help other people. And even if that's just simply checking on a neighbor to make sure they're okay, but finding something that you can do that really has value for others. And the other thing I would say is to practice gratitude. There's a lot to be fearful of right now, but there's also, for most of us, a lot to be grateful for. And there's science to show that both of those things, doing things for other people and practicing gratitude, actually change our brain chemistry and make us feel much better ourselves. Some people may want to talk to a professional. We maintain a database of professionals in the area and have been reaching out to them to find out what their experience has been. Most of them are changing to a platform like Zoom, or at least being able to counsel individuals by phone. Some have said that people are uncomfortable doing that. We've been using telehealth at the free clinic in Fauquier for a number of years, and once people get used to it, it is just as effective in terms of a therapeutic setting, and almost all of the patients at the free clinic have gotten very comfortable with using that. So people shouldn't be put off by that. Many of the providers are offering sliding fee scales. We have one provider who is offering 30-minute sessions for first responders and healthcare workers for free. So there's a lot of support. The Mental Health Association has a website which has access to those screening tools I mentioned, has a lot of information related specifically to COVID and on help finding a provider in the region. So our website is fauquier-mha.org, or you can call us at 540-341-8732. I appreciate being included in this, particularly with my buddies Alan and Craig, and look forward to the questions folks have.
Sally, thank you so much for joining us. And you mentioned gratitude there, and I have a lot of gratitude to the three of you for coming on and chatting with mental health is something that is important to our community and important especially during this time. And one question that I have that I've heard throughout the community, and I'll open this up, I'll start with Alan and work our way through with Craig and Sally again, is the high school seniors who do not have a graduation now. That I read that they're going to be doing it online, and eventually they are going to be doing something more formal. But right now there's a lot of anxiety and a lot of questions. Have you heard from a lot of the high school seniors? Have you heard from any of the high school seniors about anxiety, about how their last hurrah in high school is going, or how would you address that if you did have somebody reach out? Alan, we'll start with you.
Well, if someone were to reach out to me, I would try to talk to them again about using some resilience skills. Definitely listen to what they feel, what they're experiencing, how it impacts them, and help them work through that. Everyone is different, but we do have to be alert to exactly what individuals are feeling and take it seriously. So I would support them any way I could, help them get additional help if they need it. But I'm one of these, let's take what's going on and figure out what we can do to cope and move forward. I would definitely look to see if someone's angry, depressed, and try to study those distress reaction patterns, those emotional reaction patterns that can be harmful. Anger, getting fearful and depressed, you don't move forward. Using coping skills is the key. So we are in unprecedented times. I like to focus on what I call putting the keys on the table. What's going on? What can we do about it? Let's find a way to make something positive out of this situation and keep moving forward.
Thank you, Alan. This is Craig. Although that's not generally an issue that I would address, it is true that we grieve all losses, and oftentimes when we think of bereavement, we immediately think of a loss by death. But you're right, there is that loss of expectations and hopes and dreams and a lot of other secondary losses, including not being able to participate in something as momentous as a high school graduation. And I do believe, as Alan had said, a lot of the same coping skills do apply. I'd just like to mention that for those who may not be familiar with Hospice of the Piedmont, is that we do have a very vibrant children and teens program. We have specially trained bereavement coordinators who are certified art therapists. So if there is a child or a teen who may benefit, the same numbers that I had provided earlier and that are on the chat list there, please don't hesitate to give us a call or contact us online. And I do want to also just mention kind of like what Sally had mentioned. She brought up some incredibly great points, as I knew she would. And one of the things that I would encourage people is please do not make sorrow the measure of your love for someone who died. The highest tribute that we can give to that individual truly is gratitude. And I also think that if we focus on things for which we are grateful, it's difficult to be grateful and grieve simultaneously. And don't hesitate to reach out and support others. Oftentimes, by reaching out a helping hand to someone else who's hurting, that is often when we find healing for ourselves as well. So thank you to to Sally and to Alan for bringing up those points, because those were a couple of things that I wanted to share as well.
And Jeff, I would say we work with a lot of young people, and you are absolutely right. This has been just such a difficult time for, their spring musical that they were working on, the prom. I mean, you don't have a remote prom. You don't have a prom in the fall when everybody's gone on. I mean, they're things they're not going to be able to recapture, and there really is I think a sense, as Craig said, of grieving those losses. One thing I think that has helped some people is, again, finding ways that they can contribute, getting out of that concentration on your own losses. I'll give you an example. Our local food pantry is very active up here. I live in Rappahannock, and the food pantry is really a cornerstone in the community, particularly at this time. And a lot of their volunteers are older individuals, and they have asked if we could find some younger volunteers in the community because they didn't want to expose vulnerable older people to possible contamination. So a number of young people from our community have been very active in giving out meals, et cetera, for the food pantry. So just another way to help. It's doesn't bring back the prom, but at least enable someone to focus on some of the things they can do positively in the meantime.
Well, pivoting, you mentioned the seniors on the other spectrum of the older folks that are possibly in homes, or they're isolated because they're at home and nobody can come see them. What can you tell? How do you help older folks, senior citizens in this situation that are feeling extremely isolated because they've lost a lot of their support system, or just not be able to connect with them in the way they have in the past? Sally, we'll start with you this time.
Start with me this time? Okay, good. Very a lot of concern about people who are isolated, just from practical points of view, not being able to get groceries and prescriptions and things like that. One of the great groups here in Rappahannock is called Rap at Home, and they are making daily phone calls to people. They have it's one of the village-based concepts of older individuals supporting each other. So they have a membership, but they've also expanded that not only to the community at large, but also some of the older volunteers in Rap at Home are calling students who are home and needing some additional support, some of the children in the community. So just that networking to have a person to talk to and to help brainstorm problems that you're having. A lot of older people are not necessarily connected to the same sort of technologies that are so important right now. So phone call does work, but it does mean that they don't have quite as many tools that they can use. I don't know. Let's see. Craig and Alan, what would you say?
Well, something that I would emphasize, particularly for anybody who is bereaving, even under less stressful times, is it's not always particularly helpful to tell someone, hey, you know what, just give me a call if you're having a difficult day or if you need something. Please, at a time like this, take the initiative. If you're aware of anyone, a senior or any other individual who you believe might have a limited support network, take the initiative to contact that person. Assure them that they are in their thoughts. And, if you're going to the store and you know that that individual may have reasons all their own why they may be at risk if they themselves go, let them know that you will pick something up for them and that you will drop it off and maybe give them a call and let them know when it's on their front porch. But take the initiative. Again, we often think it's helpful, to be available to individuals, and that is true. But oftentimes, anybody who's grieving or for, again, maybe reasons of their own, may be reluctant to call, even though the help might be truly needed and appreciated.
Hey, I like that. It's all about empathy and understanding people's circumstances, and it can start just with you and your family. If there's someone elderly, remember the day where it says, hey, call your mom if you haven't talked to her in a while. Call family, call friends that are older that if you know somebody through work, and I think of the senior centers with them closing, if staff or people could say, hey, we need to stay and develop a system where we can stay in touch with these people. And I'm with Sally on it. If phone is all you have, then that's what you have. That's better than nothing. So just hearing a voice and communicating, hey, I care about you. If you need help, I want to be there the best way I can. And so if we can get that movement going with everybody in the country, a neighbor, somebody that's elderly, make a contact and stay in touch and let them know they matter, you care, and you want to help.
Well, thank you all. I think that was great information. Once again, this is the Culpeper Chamber of Commerce Town Hall on Mental Health, sponsored by Fauquier Health. And we'll now open it up to if anybody has any questions. We've asked if anybody had any in chat. I haven't seen any, but if anybody has any questions that they would like to chime in with, now is the time. All right. One last call. Any questions, anybody? Amy, do you have any questions? I put you on the spot.
I don't have any questions actually, but I do have a little statement to say. Something that I'm doing is I have a 6-year-old here at home, so we are full-time working from home and doing kindergarten. And one of the things we're doing is he's drawing pictures and practicing his words, and he's making cards, and we're sending them to the nursing home that my sister works at. So they have 22 residents, and they are not allowed to receive any visitors right now. So the response to that has been overwhelming, that they are thrilled with their hand-drawn pictures and their little notes. And it's something really special. It's something for people to think about if they have kids at home, even if they just color a picture, don't throw it away, fold it up and send it to a nursing home. Those people really, really appreciate it.
That's a great idea. And I'm sure Maddox enjoys that.
He does.
Hey, Jeff, I'd like to just make one last point, and I like the word flexibility in times of distress and extreme adversity like we're going through now. I'll give you an example. I teach some courses for the Bachelor of Interdisciplinary Studies program at UVA, and I work with students, and some of them have said they're adult students. They have kids they're homeschooling. They've had major changes in their household, and it affects their ability sometimes to get everything they need to get done to do their coursework. And so, to have some flexibility either on the job or with people that have some responsibilities they're working on, now's the time to do it. Give some leeway, give some support, and give some allowances for people to be able and under distress to get the things done they need to get done, and give them support.
Great advice. Thank you, Alan. Well, if nobody else has anything else, we'll adjourn the meeting. Thank you all for joining the Culpeper Chamber of Commerce for our town hall on mental health. We are hosting the town halls every Thursday at 1 p.m. The next one, we're just going to have a community check-in. We ask everybody to kind of come in and let everybody know how you're doing, how your business is doing, how your nonprofit organization is doing during this time. We just want to have a check-in, share information, gather, and have some fellowship. So that is going to be scheduled for next Thursday at 1 p.m. And then on May 13th, please join us for our State of the Community. We're going to be hosting that digitally. It's something a little bit new for us as well. So we hope everybody joins us and is able to listen to some fabulous speakers from our community that are going to address how we are dealing with this COVID-19 crisis. So once again, thank you to Alan Rasmussen from our RCS, Craig Wilt from the Hospice of the Piedmont, and Sally Morgan with the Mental Health Association of Fauquier for joining us here today. Appreciate you all for chatting with us and had some great information. Thank you all.
Thank you, Jeff.
Yeah.
Thank you.
Thanks. Bye-bye.